Aching pain here in your TFL muscle can hang around for months or even years if left untreated. So today I'm going to show you how to release your TFL muscle for immediate relief, and then 2 exercises that fix the root cause so that you can be rid of your TFL pain forever. Huge muscle knots can develop in the belly of a painful TFL, causing this entire area to ache. But releasing those knots can provide instant relief and make the next 2 exercises more effective, so here's how you do that. The TFL muscle sits between the bony lump at the front of your pelvis and the bony lump of your hip bone. Compressing the muscle flushes out toxins like squeezing out a dirty sponge, so place a firm tennis ball over the muscle and lie on it face down with the leg of your sore TFL straight, the other knee bent, and one arm back. Move around a bit until you find a really tender part of the muscle, and then lie with the ball on that spot without moving for 30 to 60 seconds. After a while, that tenderness should reduce. You'll often find a few sore points very close to each other, so then just move on to the next one. Make sure that the ball isn't pressed up against any bony parts though. After 3 to 5 minutes of doing this, you should notice that it feels a lot better, so do that daily, especially before you do the next 2 exercises until it's completely pain-free. Now that your TFL is looser, you're ready to fix the 2 underlying causes. A TFL gets tight and sore in the first place because it's not strong enough to do its job, so firstly we need to strengthen it. Set up by standing facing a wall or a doorway with your hands on the wall. Then with a bent leg, bring the leg of your sore TFL out to the side, a bit forward, then slowly lift your foot up to internally rotate your leg, hold for a moment, and slowly lower your foot again. Then repeat. You should feel your TFL working each time you internally rotate your leg. The secret here is to only do that movement until you feel a light fatigue in the muscle, but no more. This can be anywhere between 2 to 10 reps for most people. We want to flush the muscle with blood and gently strengthen it, but not strain it. If it feels like even a couple of reps is too much, only lift your leg half as far and internally rotate it less. Repeat that until light fatigue 3 times a week. Lastly, we want to take pressure off your TFL. The main action of your TFL is to stabilize your pelvis and your knees, but other larger outer gluteal muscles should be doing most of the work, and if they're weak, your TFL has to compensate. So here's how to strengthen that whole outer gluteal area. Set up by placing your hands against a wall and standing on the leg of your painful TFL. Then use the muscles of your outer pelvis to slowly tilt your pelvis up on the other side, hold for a few seconds, and gradually lower down again. Make sure that you're using the hip muscles of the leg you're standing on to control the whole movement. In the first rep, lift your pelvis directly to the side. But as you continue, begin to alter the angle by about 10 or 20 degrees. So lift the other side of your pelvis slightly behind you, and then lift slightly up in front of you. Repeat these 3 directions until you feel a light fatigue in your outer pelvic muscles, but no more 3 times a week. Just make sure that you don't stick your pelvis out behind you as you move. Bring your pelvis forward in line with your body before tilting up to the side. The key to long-term TFL relief is to strengthen all of those outer hip muscles, including your TFL, and keep them strong. So when you start to feel better, don't stop doing those last 2 exercises. For a great alternative way to strengthen that whole outer pelvic area in one simple exercise, make sure that you watch this video next.